Thank you, Robert, and thanks for the Neighborhood Council and the church for really sponsoring this for all of Richmond's residents. And I want to start by first thanking residents of Richmond and this county for really working hard since early March, when the shelter-in-place order was first issued, to stay home and social distance. And I can tell you that our health officer has said that the collective actions of all of us have reduced the spread of the virus, kept our hospitals from becoming overloaded, and saved lives. And that's good news, because the more effective we can be in this area, the quicker we can get everyone back to work. But we still have a lot more work to do, and that's the reason why our health officer extended the order through May 31st. As you may be aware, Contra Costa County and 5 other Bay Area counties was the first place in the United States that initiated a shelter-in-place order. And that was because our health officers were all seeing concern about very fast community spread of this virus, and that this action, very extreme for all of us, needed to occur to slow the spread. We also know that many people are experiencing financial hardship as a result, and that will continue and could get worse the longer this goes on. And I'll talk a bit about some of the actions we've taken to try to help those who are financially suffering. So where are we in terms of cases and hospitalizations? So right now, there are 891 positive cases in Contra Costa County. Of those, 111 cases in Richmond. So Richmond's about 10% of our county's population and about 12% of the number of cases. So we are not seeing a higher number or percentage of cases in Richmond as we are in other parts of the county. In fact, some of the areas hardest hit are communities like Orinda, where there was an outbreak at a senior facility. There's been about 13,000 tests conducted in the county. So there's been about, so far, a 7% positive rate of those tests. There's around 300 to 400 tests a day that are occurring in the county, and our health officer believes that we need to get to a point of having closer to 2,400 tests a day to really monitor, especially if we want to come out of a shelter-in-place order. Right now, there are 3 locations where testing is happening in West Contra Costa. If you are a Kaiser patient, you can get tested at Kaiser Richmond. If you are a member of the Contra Costa Health Plan, you could get tested at the county's health clinic in San Pablo. And if you get your care through Lifelong Medical Center, you can get tested there. That testing, those 3 test sites have been up and running since early to mid-March. Last week, the county expanded its testing at its health clinic in San Pablo for anybody who wants to get tested there. And that's free drive-through testing, and that is available now for anybody, not just Contra Costa Health Plan Medi-Cal patients. The county's been at the center of responding and preparing with regard to this virus. We estimate that between March and June, we will have spent $100 million out of our reserves to address the health and economic consequences from the virus. We've been working with all hospitals in the county to double their hospital capacity to prepare for a potential surge in patients, which fortunately we're not seeing yet. There's about 1,100 hospital beds in this county, and that capacity is being increased to about 2,200. In addition, working with federal and state partners, the county has opened a medical center at the Ford Building at the Craneway Pavilion in Richmond that would have 250 beds. We have not needed to open that, and we hope we never will, because we hope our hospitals will not get overcrowded. Those beds will only open if hospitals are overcrowded. We've also prioritized our homeless population. We have rented close to 500 hotel rooms in the county, and that will soon go to 600, and have transferred homeless individuals from shelters, the three largest shelters, including the Richmond Rescue Mission and the county shelter in North Richmond and one in Concord. We've transferred about 250 of those individuals to these secure individual hotel rooms where they are receiving care 24/7 by one of our community partners. And we've also identified vulnerable homeless residents at encampments and moved them to these hotel rooms. One of the hotels is local to the Hilltop area, and that's the Courtyard Marriott, which has about 145 rooms occupied that we've rented for homeless individuals. Most of those individuals were previously at the Richmond Rescue Mission. We've also taken steps to financially address concerns. Using our state emergency powers, we passed a countywide rent freeze, as well as pretty far-reaching eviction protections, and the City of Richmond has passed an ordinance as well. And the ordinance provides for no late fees, for no increases in rent, a grace period of several months, 6 months in the case of Richmond, for people to pay their rent. In addition, we have provided about $20 million in funding to our community-based nonprofit partners who provide health and social services to more impacted and vulnerable populations in our county, including many here in Richmond. We have set up a hotline for small businesses to call to help access federal and state revenue. So when are we going to come out of this shelter-in-place order? The Bay Area health officers just yesterday released a number of guidelines or indicators that we could measure. One is very similar to the governor's. One of them is having a decrease in hospitalizations for 14 straight days. Another is having less than 50% of our staffed hospital rooms in the county occupied by COVID-19 patients. Another is increasing our testing capacity to 2,500 tests per day, and also having the ability to do contact tracing and quarantine those who are tested positive. In addition, there will be we set up an ability for free child care for emergency first responders and essential workers. So I'm optimistic that with the collective action we've all taken, that we will move through this, but there will be continual restrictions in place. There is concern of what will happen in the fall when there could be a potential second surge. So for now, our collective actions are making a difference. So I just want to thank Richmond residents for that and end with a closing comment, which really was one that our governor said recently. He said, you know, you can't run a 90-yard dash when the race is 100 yards. And that's why our health officers believed it was important to extend the order and not lose the progress we've had and turn back yet. And they're going to be monitoring over the next few weeks all the data to look at where we go at the end of May. So with that, I just want to also say there's been a great partnership between the county and the city, with all of our cities, and there's been a great partnership here in the city of Richmond, who are important partners as we go through this.